right. We're good here. All right. I think that we are ready to go. Let's make sure that I got the. Looks like we're ready. So, good morning, everyone. Obviously, let's start off with a roll call before we get started. Ms. Jones, if you could please call the roll.
Thank you, Mr. Chair. Senator Brooks.
Here.
Senator Cancela. Senator Canizaro.
Here.
Senator Goycochea.
Here.
Senator Keffer.
Here.
Senator Woodhouse.
Here.
Assemblywoman Benitez Thompson. Assemblywoman Howdigi. Assemblywoman Monroe Moreno.
Here.
Assemblyman Roberts.
Here.
Assemblywoman Tolles.
Here.
I'm going to go back and see if some of the others are here yet. Senator Cancela.
Here.
There she is. Assemblywoman Benitez Thompson. And Assemblywoman Howdigi.
Here.
And Chair Frierson.
I am here. Thank you. And Ms. Jones, normally we would say mark them present as they arrive, but we'll all know. And so we will continue on and acknowledge them when they do arrive. Just some brief remarks before we get started and before we go on to public comment. This is, of course, our first meeting of the subcommittee to review and advise on the coronavirus federal aid. We established this subcommittee on May the 21st. And the plan for this meeting today is to hear a high-level overview of where we are and then, of course, where we plan on going in response to the coronavirus. We're going to hear information about the distribution, expenditure, and proposals on the planned use of coronavirus relief funds. I do plan on holding additional meetings, and we will have additional areas of focus. But this first one, again, is intended to be an overview. I want to stress, and I've talked to members before, obviously it's a lot of information, we have a lot of questions, but this meeting is the what, not necessarily the why. This is where we are and what we have and what's left, and we'll have subsequent opportunities to get into the weeds on some of the questions that we may have about why decisions were made. And I'm sure there'll be a couple, but I'd like to stick for this first meeting to just that, to the what and not necessarily the why yet, and reserve that when we have more of the involved parties like local government and higher ed, other partners that would be able to make their presentation and then answer questions. But there's a presentation that was provided to members. It's posted on our website yesterday, so it's available to the public. An additional document, I think, related to federal funds was provided by local government, to local government, was provided by the governor's finance office yesterday. Our agenda today has 3 different areas of discussion, and the presentation includes all of that. I want to thank the governor and the governor's office for, I think, their interest that we share in transparency and wanting to be able to provide information both to our body, but also to the public about the assistance that we've received and what it's been spent on and what our intentions are moving forward by the end of the year, and provide a venue for recommendations moving forward with whatever may be remaining, recognizing that we also need to be prepared for anything that might happen by between now and the end of the year. And before we further go on to public comment, I also wanted to just on the record take just a moment to acknowledge that today is the 19th anniversary of the 9/11 attacks. And I was reminded as soon as I woke up this morning and turned on the news of, it seems like it was just yesterday. And we still are feeling the effects of that. And I think deaths related to that, as well as changes in how we live and govern. And so I want to acknowledge that 19th anniversary as a solemn reminder of how far we've come and how blessed we are. And so with that, I will move on to public comment. And it's published on the agenda, and it can be made by mail, by fax, or calling in. The number is 669-900-6833, and there are directions for participating. Because of time constraints, we will limit public comment as typical to 2 minutes per speaker, and I will take up to a total of 45 minutes for public comment at the beginning of the meeting. And then, of course, at the end of the meeting, there'll be another opportunity for public comment as reflected on the agenda. And just so those who haven't done this before and the public know, we have broadcast staff. So our broadcast and production staff are going to be interacting with folks making public comment, providing testimony and facilitating that participation. And so with that, if staff, we can queue up folks and add the first caller with public comment.
Thank you, Chair. Caller with the last 3 digits of 978. Please slowly state and spell your name for the record. You will have 3 minutes. Please unmute and begin.
Good morning, Chairman Frierson. Can you hear me? This is Joanna Jacob.
I can hear you, Mr.
Okay, thank you. Good morning, Chairman Frierson and members of the subcommittee. Joanna Jacob, Joanna, J-A-C as in cat, O as in O, B as in boy. I am Government Affairs Manager for Clark County. We are offering some comments this morning on behalf of Southern Nevada, who has been particularly hard hit by COVID-19. In the initial days of the pandemic, we know that many of you know we will never forget the eerie sight of the strip that was shut down and what that means to the people who work in our hospitality industry and throughout our region. Our comments today focus on the secondary crisis we fear is looming, the risk to housing stability while benefits are delayed and unemployment persists. And this is a concern for our Clark County leaders, our staff, and our municipal partners. We've offered a letter, Chairman Frierson and members, that we filed yesterday, so I have that in the record. Just briefly, we know that the Gwynn Center for Policy Priorities is forecasting as many as 249,700 renters in Southern Nevada that could be at risk of eviction due to COVID-19. The county has prioritized using its coronavirus relief funds to support the community, including $30 million for rental assistance, and with your assistance and with the governor's assistance, supplemented by $20 million. And so we are grateful to our state partners and to the members of the IFC for your support for this program. But we know this funding is woefully inadequate to meet the needs in the months ahead. And we can estimate that we can only assist about 14,000 households at our current funding levels. With 75% of the state population and the highest number of renters statewide, we fear we cannot meet this need. The Gwynn Center is estimating up to 142,000 households statewide could be at risk of eviction, and to meet the needs of even half of that amount, with the 3 months of assistance that we have in place today, the funding needed is estimated to be about $212 million, of which Clark County's proportionate share, based on our population, would amount to $159 million. And this is a staggering amount. And we know that it's staggering. And as you go about the work of this committee and you review allocation of funding, we're asking for your help to expand rental and housing assistance in any way to Southern Nevada. It's critical to the health of our community that we help as many as we can to stay safely in their homes. We have further comments. We link to the Gwynn Center study in our letter. Thank you for your review. And this request is joined by our municipal partners, Boulder City, Henderson, Las Vegas, Mesquite, and North Las Vegas. Thank you for your time.
Thank you. Caller with the last three digits of 395, please slowly state and spell your name for the record. You will have 3 minutes. Please unmute and begin. Caller with the last three digits of 395, please press *6 to unmute and begin. Caller with the last three digits of 847, please slowly state and spell your name for the record. You will have 3 minutes. Please unmute yourself and begin.
Thank you, Speaker Frierson. Can you hear me?
Yes, we can hear you. Go ahead.
Thank you, Speaker Frierson and members of the IFC Subcommittee to review and advise on coronavirus federal aid for the opportunity to speak to you today. For the record, my name is Christopher Boyd, CHRISTOPHERBOYD, Government Affairs Specialist for the City of Henderson. Since the start of this pandemic, the City of Henderson has collaborated with Clark County and our neighboring cities of Las Vegas, North Las Vegas, Boulder City, and Mesquite to respond to the public health emergency and address the severe financial strain that is placed on families and businesses in our community. As was noted by the county, the Gwynn Center study showed that as many as 249,700 Clark County residents could eventually be at risk of eviction or foreclosure if conditions do not improve. In Henderson, we estimate that number could be almost as many as 20,000 of our residents alone. Statewide, over $1 billion in tenant debt could be owed by the end of this year. Currently, Clark County has designated $30 million of its coronavirus relief funds in a county-wide financial assistance program to provide rental assistance in order to keep people in their homes while battling this pandemic. And the state of Nevada is adding another $30 million statewide, with $20 million allocated in Clark County. The City of Henderson plans to dedicate $1 million of our allocation of CRF funds to Henderson residents specifically. We have also hired a communications firm to perform targeted outreach with our most vulnerable residents to connect them to housing assistance as well as other resources. But that scratches the surface of what is needed to prevent a crush of evictions by the end of this year. The City of Henderson is grateful to both Clark County and the state of Nevada for their financial assistance programs, and we urge the state to provide more funding in this area to help keep families in their homes as we work to stop the spread of this disease in our community and prevent homelessness. Thank you, Mr. Speaker and members of the subcommittee.
Thank you. Caller with the last three digits of 029, please slowly state and spell your name for the record. You will have 3 minutes. Please begin.
Good morning. This is Lisa LaPlante, LISA LAPLANTE. Can you hear me okay?
Yes, please go ahead.
Good morning, Chairman Frierson and esteemed members of the Coronavirus Subcommittee. This is Lisa LaPlante on behalf of the City of Boulder City. We concur with the statements that you just heard from Clark County and Henderson. The City of Boulder City, like many communities in Southern Nevada, has residents facing challenging financial times due to the economic effects of the pandemic. Providing some measure of relief for those affected economically is a pressing public policy matter. The city supports endeavors to secure funding for residential, rental, and mortgage relief. Boulder City supports the efforts to keep all Nevada's families in their homes with no disruptions. Thank you all for your time and commitment.
Thank you. Caller with the last three digits of 395, please press *6 now to unmute yourself. Then slowly state and spell your name for the record. You will have 3 minutes. You may begin.
Can you hear me now?
We can. Please proceed.
Thank you. This is Councilwoman Pamela Goins Brown, PAMELAGOYNES-BROWN. Thank you, Chairman Frierson and members of the committee, for all your thoughtful and diligent work in providing for the citizens of Nevada and ensuring that CARES Act funding is used responsibly, fairly, and effectively. Unfortunately, Southern Nevada has had to fight for our fair share of federal relief dollars, and we continue fighting. According to the very clear U.S. Treasury regulations, cities in Southern Nevada with population under 500,000 should have received a combined $104.2 million in CARES Act funding. Fortunately, Clark County recognized this obvious and glaring unequal treatment and took some of the federal monies allocated to them for regional services and gave them to local governments. Although we have received only half of the dollars we should have received, we have been able to provide much needed relief to our neighbors and small businesses. Helping our residents and businesses avoid evictions will be one of the most pressing needs, and we support a regional approach led by Clark County to assist our community that's being destroyed by the pandemic. In light of the data contained in the Gwen Center study that predicts upwards of $1.1 billion in eviction prevention needs statewide, the city joins Clark County in requesting $159 million for regional mortgage and rent relief for Southern Nevada residents. Southern Nevada has been devastated by the pandemic as an epicenter for over 80% of our state's COVID cases, as well as the vast majority of COVID fatalities. At one point, our minority-majority city led the nation's highest COVID mortality rate, 66% among African-American communities, and record unemployment. North Las Vegas residents have been disproportionately affected by this pandemic and its accompanying economic downturn. There is seldom a more sobering example of the divide between the haves and the have-nots than what the residents of North Las Vegas are currently experiencing and how they were treated as federal funds were allocated. As you review the remaining resources, I urge this committee to award funds to Southern Nevada, the region most affected by the coronavirus pandemic and the region that has unjustly received less per person funding than the rest of the state. I also ask you to consider supporting communities in the South equally to communities in the North. I implore the governor and this committee to act swiftly and award Clark County and Southern Nevada cities originally excluded their rightful disbursement of CARES Act dollars so that we have a chance to keep the families most impacted safe, healthy, and in their homes. Our North Las Vegas Mayor and City Council recently adopted a resolution standing in solidarity with you and the governor, defining racism as a public health crisis. I ask now that this committee and the governor stand with the residents of North Las Vegas in the fight against systemic racism as they struggle to keep a roof over families' heads and food on the table. Thank you so much for your consideration and for all your hard work in helping our residents survive these trying times.
Thank you. Chair Frierson, there are no other callers for public comment at this time.
Thank you. The comments that were received are all duly noted, some of which I believe will be addressed today, and some of which in subsequent meetings. With that, I will move on to item 4 on today's agenda, and that's an overview of the coronavirus federal aid received by the state of Nevada. And again, for the public's edification, we're talking about the state, and there's several other entities, nonprofits, community organizations, and local government that have also received funds directly. Today, we're talking about managing what the state has received and how the state has and plans on using the remainder of those funds. And so with that, I believe we have our treasurer, Zach Canine, and Ms. Jones, is it Mr. Treasurer that's going to be providing an overview?
Mr. Speaker, I believe it's GFO. I'm just here to answer any questions and be helpful if I can.
Great. Okay.
Sorry.
I see Ms. Brown here.
Yes, Ms. Brown should be here, Ms. Henry, and Chief of Staff Michelle White is available for questions as from what I've been informed. Thank you.
Great.
Good morning, Chairman Fryerson. This is Susan Brown, the Director of the Governor's Finance Office and members of the subcommittee. I have with me today Leslie Molenkamp. She is also within the Governor's Finance Office, and Michelle White is available for questions later. We are here today to give a high-level overview of the COVID-19 federal aid received by the state of Nevada. And with that, I'm going to turn it over to Leslie, who will put a presentation up on the screen, and we will walk through a high-level overview of the federal aid that we've received to date.
So much.
Thank you, Chair Fryerson and members of the committee. For the record, my name is Leslie Molenkamp, and I'm with the Governor's Finance Office. I'm going to be starting our presentation right now, so we'll go ahead and get that on the screen. Okay. Okay, I just want to check and make sure everybody can see the presentation.
Yes, we can see it.
Perfect, perfect. Okay, so we'll go ahead and begin here. As Director Brown mentioned, we are here today as a resource to give a high-level overview of the COVID-19 federal aid received by the state of Nevada. We have experienced a little bit of a puzzle when it comes to the funding because the receipt of this federal funding has been a bit like opening up a box with a bunch of puzzle pieces. There were multiple bills that came in, multiple funding mechanisms, multiple types of recipients, which meant it didn't come in as one big comprehensive package. It actually came in as pieces that we have been diligently putting together. So when funding came in, it came in actually rather fast. And it came in with 4 federal bills that were passed in 6 weeks, worth almost $2.9 trillion altogether. We're actually not going to be speaking about the trillions of dollars because that was what came in for all of the states. But instead, what we're going to focus on is what Nevada received, which we currently estimate at $19 billion as of September 2nd of 2020. Again, this is the data we're using. So first off, the very first bill we're going to cover or just go over very briefly was the Coronavirus Preparedness and Response Supplemental Appropriations Act 2020. This was passed on March 6th of 2020. And to date, approximately $8 million has come into Nevada, mostly aimed at public health and medical response. That was our first bill that came in. We then, after that, had a second act that passed, which was the Families First Coronavirus Response Act. With this act, approximately $373 million has been received in Nevada, and most of this funding centers on paid sick and family leave, free coronavirus testing, expansion of unemployment benefits, food assistance, and additional protection for frontline health workers. That's mostly what that covered. And again, that was on March 18th that came in. So we had a third act that passed shortly after that, and this was the big one. This was the Coronavirus Aid, Relief, and Economic Security Act, or CARES Act, and we are all very familiar with this one. Nevada has received approximately $15.6 billion from the CARES Act, with the largest amount of aid going to the Paycheck Protection Program, which issued forgivable loans to small businesses. The CARES Act also provided aid to businesses, very directly to businesses, healthcare, farmers. We had some going to airports and transit agencies as well. CARES funds also went to the states and local governments and included major packages for education and childcare as well. And 2 of the biggest allocations of this act were the cash payments to individuals and increased unemployment benefits. We're all familiar with the checks that were issued by the Treasury to citizens, and that was a major part of this act. We're going to be talking a little bit more about the CARES Act in a moment, but we did want to cover it in the overview. We are going to go ahead and take a look at the fourth bill, or the fourth act that was passed next. And this last piece of legislation that came out was the Paycheck Protection Program and Healthcare Enhancement Act. So Nevada has received approximately $92 million of these funds since its passage in April. This act increased funding to the Paycheck Protection Program. It provided additional emergency economic injury disaster loans. It expanded lab capacity for COVID testing and provided additional funding for hospitals, and COVID testing was also included for rural health clinics. Okay. So now that we've had a quick overview of the 4 federal bills that generated the COVID-19 aid, let's go ahead and take in Nevada specifically. So in total, Nevada's share of COVID-19 federal funding from all 4 of these federal legislative acts is estimated to be $19 billion. We're showing you here a breakdown of what funding was received in Nevada. And you can take a look at this pie chart. It represents what funding was received in Nevada. And we want to give our credit to the grant office, who worked very diligently and very hard to collect this information and get this together. You can see that the Coronavirus Preparedness and Response Act is less than 1% of the total funding that was received in Nevada. And the Family First Act and the Paycheck Protection Program is just at about 1%, so very small amount. You can see here on the pie chart that we have approximately 3% indicated in other types of COVID-19 aid. And we also just wanted to point out that there's another category here at 12%, which is titled multiple bills. This is an estimated 12% of the total. This category represents funding that has occurred through multiple pieces of federal legislation. A big portion of this is from the Economic Injury Disaster Loans, which were funded by both the Coronavirus Preparedness and Response Act, but it was also funded by the Paycheck Protection Program. So again, this is just a slice that represents some of these bills or some of these programs that were funded through multiple acts. And so we want to make sure and point that out there. But the main thing here that you can see is that the biggest piece of the pie actually lies with the CARES Act. It's approximately 83% of the total COVID-19 federal funding that's been received. So let's take a look at funding by category here really quick. You can see that economic relief, unemployment relief, and disaster response, these 3 categories are very fittingly the categories that have received the most funding. So you're seeing the breakdown listed here. Now, since the CARES Act dollars are the largest part of the funds we've received so far, we are actually going to take a look at this piece now. But before we do, at this point, I think we have covered agenda item number 4. Our next items cover agenda items 5 and 6, and we can pause here or we can continue on with the presentation.
Members, this is, I suspect it's going to get thicker as we go. So if members have questions now, let me know. Or if folks want to wait, I'm not as technologically savvy, so let me see.
I have a question, Mr. Chair.
Senator Kinsella.
Thank you. Can we go back? So if we're looking at the presentation, there's the slide that indicated how much money we got directly through the CARES Act bill. And then we got to the 19 billion figure. And I didn't write down the exact figure from all of the different pieces of federal legislation, but it didn't seem they added up to 19 billion, which is almost 2.5 times our annual state budget. Can you walk us through how you came up with that figure?
Yes,
I
Leslie Mollenkamp for the.
Sorry, I saw the buckets it went to, so that's not what I'm interested in. It's how you calculated that that was the number based on the discrepancy between those figures and the federal allocation from those bills.
So Leslie Mollenkamp for the record, I'll go ahead and put the slide back up so that we can speak to it. I do believe that Director Brown will be commenting on this as well. So I'll go ahead and get that situated so we can take a look at it. Okay, I believe that we are looking at the breakdown of funds. And we have the figure of 19 billion. If you'd like to show me or explain, which slide you're referring to, I can zoom into it.
Sorry, my question is that 19 billion is a significantly greater total than what all of the 4 federal bills add up to. So I'm trying to understand the discrepancy. Where did those additional $1 billion come from?
Leslie Mollenkamp for the record, and again, Director Brown may comment on this as well. I do believe that the further we go down the presentation, you might get a little bit more clarity on that, because we will be looking specifically at the CARES portion of that, and then we will also be looking at the amount that has directly come in through work programs. So some of that clarification might come through the presentation.
If I could interject a little bit, so have we not gone through? I think she's just considered. I don't want to speak for her, but just generally, what adds up to 19? I have some notes, and I think a large chunk of that is specifically CARES dollars. I think over 15 billion is CARES dollars alone. And then, Senator, are you just? I'm looking at my notes to say there's about 15.6 billion in CARES dollars, and then there's the other ones that are obviously smaller amounts. But are you saying that those smaller amounts don't add up to 19 billion? I think it's close with those. I think there's 8 million, 373 million, and then 92 million outside of the CARES dollars. That I think
I didn't write it down correctly, but I thought in the first purple bucket where it outlined the CARES Act allocation to Nevada, I thought it was much less than 15 billion, but maybe I just wrote it down correctly. So if we could just go back to that slide to make sure that I have my notes correct, that'd be helpful.
Absolutely. Let's see if we should be. I believe this is probably where you're speaking to. We had the 8,373,000. And then, of course, our largest piece, the 15.6 billion.
Okay, I didn't write down numbers correctly. So thank you for going on this journey with me to catch me up. I apologize to the committee for not keeping up the way I should have. So thank you.
Mr. Chair, if I may ask a question.
Senatorwoman Toles.
Thank you, and thanks for this presentation. Thanks for the slides and for posting those for the public as well, because I know there's a lot of interest across the state on how those funds are being allocated and just how to track what's been allocated so far and then where we're going to put the remaining dollars. Is there one specific website that we could direct the public to, our constituents to be able to check in real time on a regular basis for these updates? I noticed on slide 19, for example, that you point out that we have 91 different programs that these CARES Act dollars are going to. And so I'm just wondering if we have that resource available for the public.
And Leslie Mullenkamp for the record. Yes, we do. Actually, we have our grant office who has put in a tremendous amount of work in putting all these pieces together, because again, it has been quite a puzzle to put together. The grant office website is grant.nv.gov. And they have a link right on that main page that is COVID-19 funding. And there are reports that are presented there that are updated. I can say that, again, we can't emphasize enough that this has been very much putting pieces together because of the various ways this funding has come into the state. So as we go further along and week after week, we do find and are able to collect more and more information. So our reporting becomes more and more refined over the weeks. And I do want to make sure to point that out. But the grant office, grant.nv.gov, does a weekly updated report that includes all of this information you're seeing here.
Wonderful. Thank you for that.
Mr. Chair, if I could ask a question?
Assemblywoman Howard.
Thank you. Ms. Mullenkamp, if we could go back to slide number 9, where we have the breakdown of the federal funding by category. I just had a quick question because I want to know if we're going to go into these buckets in more detail, because I'm showing that the funding is showing in thousands. And so my question is, like, for the rental assistance that was awarded out, I'm assuming that's being counted under economic relief instead of housing, because this is indicating that we've only spent $76,000 in housing. Correct. So is that, I'm assuming, is the housing counted under economic relief and development? So will we be going into these a little bit further as we go through the presentation?
Leslie Mullenkamp for the record. Yes, we will be going into a little bit more detail as we get into the presentation. One of the reasons why I'd like to point that out is that that amount, that $19 billion amount, 15.6 billion of that is actually very specific to CARES Act. And as we continue on in the presentation, we'll be actually breaking that down a little bit further and taking a closer look at that CARES Act amount. And again, that's the majority of the funding we've received. So I do believe that you're probably going to see a little bit more details that would help with those questions. Okay.
Thank you.
Other questions?
Mr. Speaker, Senator Goycochea, I assume I'll just give it some time and we need to get through the process. But yeah, and again, I look at some of these, industries that have been assisted by the CARES Act funding. Are we going to walk into how they would in fact access those programs? Because I think in a lot of areas, even in the rural, especially in the rurals, they're just unaware of that this money's available and I'm sure it's the same in the urban areas, how they access it. Everybody's focused on DETR, but I'm assuming not all this is $19 billion is going to go through DETR. But I guess we'll wait for Mr. Brown.
Leslie Mullenkamp for the record. Yes, we will be going through a little bit more which programs those are. And again, as pointed out earlier, our grant office is providing a really great summary so we know where those programs are. But today we are covering it at a pretty high level overview. So we actually won't be necessarily covering how citizens can get access to these programs. But certainly that could be a really great follow-up for us, on the future meetings. But today, really, we wanted to give a good overview and scope of what we have in there, and then we could also start digging down a little bit deeper into the details as we go.
And Senator, if I may, I do intend on having a separate meeting. And I think a lot of the communication and outreach and information is provided locally. And I do intend on having local government come before the committee to talk about their process, what they've done, what they're doing, and their plans on making requests and what they've already received, as well as providing a forum through this subcommittee for recommendations. Another note, and I'll say it, I guess, at the end of the meeting, and I can say it now, is after this meeting, I'm going to also be asking that members of this committee provide suggestions and requests about some of these questions and some of the areas that need to be covered in subsequent meetings. So just know that I'll be canvassing everybody on the subcommittee about their thoughts on future meetings and topics and stakeholders that need to.
Thank you.
All right, if there are no other questions at this point, if we can move forward and some of the stuff I see, there's some work programs and other things that are described. But again, this is a lot of information and it's a high level presentation as we can move forward. Some of those questions may be answered, and I suspect that we'll have more questions that we generate as we go through the presentation that we can certainly set up for future meetings to make sure we have the right people here to provide that information. So I don't know if Ms. Brown was going to be up next or Ms. Molenkamp, if you want to continue to the next part of the presentation.
Leslie Molenkamp for the record. Yes, I'm going to go ahead and continue on with the presentation, and then I'll be handing it over to Director Brown shortly. So we'll go ahead and get.
So are we moving on to item 5 then?
Yes, I believe we've covered item 4, and I know that the next part of our presentation has information related to the next item.
Great, and I realize that the presentation includes everything, and so members obviously don't feel restrained to not be able to ask questions that relate back as things come up, because it's one big presentation. So we can go ahead and move forward.
Okay, I believe everybody should be able to see the screen again. So our next area that we're going to cover in the presentation is we're going to go ahead and take a look at the CARES Act dollars in Nevada. So we'll go ahead and click into that part right there. The CARES Act dollars make up an estimated of $15.6 billion of the estimated $19 billion that Nevada has received in total COVID-19 federal funding. And for a little bit of background perspective, again, this is 83% of the total funding that we've estimated Nevada has received. We've highlighted here that more than $6.8 billion of the CARES Act funds have gone directly to entities within Nevada. And this number was specifically called out because it represents the amounts of the Paycheck Protection Program and the Economic Impact Aid to individuals, which were direct payments to individuals and small businesses. So again, this number represents those two amounts or those two figures right there. But the state was not involved with this direct funding. It went straight out to the businesses and straight out to the citizens. However, we do believe that this number could be as big or as high as $9.7 billion when you take all of the direct payments from various programs into consideration. And right here, we've also highlighted that so far we have tracked 91 programs that are funded by the CARES Act. And this can be very confusing when someone refers generally to the funding as the CARES Act funds, because we have 91 different programs that are funded by the CARES Act. We have tried to reference in any of our documents these CARES Act programs very specifically by their program name for this reason. So moving on now to where those funds are going. We're going to give you just a couple highlights here of a few major CARES Act allocations. You can see that an estimated $241 million of the CARES Act dollars went to Medicare providers back in April. An estimated $221 million has gone to education, and approximately $4.21 billion went to the Paycheck Protection Program. Another $1.25 billion of the CARES Act dollars went towards Nevada's share of the Coronavirus Relief Fund. So you can see these are the major allocations that we're highlighting here. So much of the CARES Act dollars have come in directly to our citizens, directly to hospitals, airports, and other places. But today, what we're going to be looking at and what we're going to be focusing on is the dollars that have come in directly to the state of Nevada. And this would be directly into our checking account through work programs. And so when we take a look at the work programs that have been approved, currently approximately $1.9 billion in federal COVID-19 direct payment or grant assistance has been received into the state's budget account through work programs. We've had 26 work programs that have gone before the IFC to accept funds. So you guys are all familiar with that. We also have pointed out here on this slide that various state agencies have been involved in this, including Education, Health and Human Services, the Secretary of State's office, Business and Industry, Agriculture, Public Safety, and the Governor's Finance Office as well are all managing these funds. So various state agencies are managing the funds and working with to provide those work programs. We are all working with a wide range of federal partners to carry out the various programs, grants, and federal assistance. And you can see some of these listed here. Again, we have the acronyms here, but these are our federal partners that we're working with to manage the funds. Each of these federal partners is responsible for their own programs, and there is no single federal resource available where you can find this information collected in one spot. Each of these federal partners manage their own piece of the CARES dollars. So all of these 26 programs vary in their duration or their performance period, as well as their uses. And we are finding that several programs even have the same allowances. So deciding what to fund first or what fund to use first is paramount when we're making decisions. So this is obviously just an overview. So let's take a look at those specific work programs that have occurred so far. Here you can see all of the work programs previously approved by the Interim Finance Committee that brought COVID-19 funding into the state's bank account. I'll give you a second to take a look at here. You can see all the various ones. Of course, you're all familiar with that. But you can see that the largest amount on this list, and it's in the upper left-hand corner, is the Coronavirus Relief Fund at $836 million. We are going to be focusing on this piece next because it is the piece of CARES Act funding that was provided directly for the state's use. So we'll go ahead and move to that next. So now that we've taken a look at the CARES Act in Nevada, we're going to go ahead and dive a little bit more into the Coronavirus Relief Fund, or the CRF. So Title V of the Social Security Act, Section 5001, Coronavirus Relief Fund, created the fund. It was signed into law on March 27th, 2020. Legislation provided how the fund was to be appropriated and the amounts. So we're going to take a look at right here at how the appropriations were established. So here's how the Coronavirus Relief Fund was allocated from the Treasury. It was based on population, and Nevada actually received the minimum payment amount of $1.25 billion because they set a minimum threshold. Local governments with populations over 500,000 could elect to receive their payments, their portion of the payment, directly from the Treasury. And Clark County and the city of Las Vegas have higher populations that meet the threshold, so they were eligible and they chose to take their portion of the funds directly on behalf of their populations. The state of Nevada received the rest of the funds, the $836 million, on April 28, 2020. And of that amount, $148 million went to local governments outside of Clark County that had populations less than 500,000. So what remained for the state was the $687.5 million for the state's own direct spending for eligible uses of the funds. The allocation breakdown is presented here. You can see that Clark County received $295 million. The city of Las Vegas, directly from the Treasury. The city of Las Vegas received $118.9 million directly from the Treasury. And then the local governments outside of Clark County were allocated with a total of $148 million. And of course, as mentioned before, we have provided a breakdown of how the local governments have planned to use these funds so that you have that available. The remaining funds for the state to use were $687.5 million. So let's take a look really quick at the fund uses. The Coronavirus Relief Fund has three main rules on the use of the funds. First of all, the expenditures must be necessary due to the COVID-19 public health emergency. And because it has to be very directly related, this rules out using any indirect costs. So for anyone who's managed grants before, this can often be a normal use of it. This does roll out using indirect costs. The other thing is, as far as it being necessary due to the COVID-19 public health emergency, we have found that throughout various pieces of guidance, it cannot be used to prepare for another pandemic or a long-term extension of this one. And we'll get into that a little bit more, but basically, it does have to be used for this immediate emergency. Our second rule on the use of the fund is it must not be accounted for in the fiscal year 2021 budget. However, if there is a budgeted service that changed substantially and very directly because of the pandemic, it is eligible, or that eligible cost can be covered. So that is a caveat right there. The third rule is that it must be incurred between March 1st of 2020 and December 30th of 2020, this cost. This has been a big challenge, especially as we are moving into the next 2 months. These funds had to be allocated fast to be able to give time for projects to move forward. So this has been a big challenge, and it will continue to be a challenge over the next 2 months. So the Treasury provides additional guidance on the use of the funds because those are the three main roles, but they have additional guidance that they've been providing on the allowance and eligible uses of the funds. So there's two main documents that they've been updating. One is a guidance document, and the second one is a frequently asked questions, or FAQs. In the last 4 months, the guidance documents, the FAQs, and any kind of guidance related to reporting requirements, those documents have been updated 9 times. And the most recent update that we've seen occurred last week for both the guidance document and the FAQs. These changes are currently under review by our office on what types of impacts this may have on any kind of fund allocations. And we've listed a timeline here to summarize the many updates that we've had on the guidance and the FAQs. And as you can see here, it is a challenge to stay on top of the changes, but it also provides a very big challenge in making decisions on funding. One good example of this is on recent FEMA allowances and unemployment allowances that have happened in the last, a few weeks. These are very large expenses, and we would normally budget with these in mind first and then allocate remaining dollars. But instead, it has been the other way around. So there's often this start-stop as part of the allocation process because of these continual updates that we've been experiencing. And Director Brown is going to speak to this momentarily, just to give you some examples of the impact these changes have had on any kind of allocation decisions. So I'm going to turn it over to her really briefly to talk about some of those challenges.
Thank you, Director Brown.
Good morning. So one of the challenge has been with the coronavirus relief funds is that initially we were not able to use these as a match for the federal FEMA funds. And then guidance came out and allowed for that usage. So we swapped $6.2 million in disaster relief account funds with the coronavirus relief funds. So that was one. And then another has been with FEMA as well, with the National Guard. That was funded 100% by our federal partners through July 31st. And then guidance came out that they would no longer fund that with the FEMA funds, and we were going to have to use coronavirus relief funds. We were informed yesterday that we can use 25% of the funds, the coronavirus relief funds, to match those federal dollars for the balance of the fiscal year. So you will be seeing the Interim Finance Committee will be seeing a work program soon on that $7 million that is anticipated to be needed to continue the use of the National Guard through the end of the calendar year. So those are just some examples of some of the changes that we have seen. And obviously we continue to see changes as recently as last week that we are working through.
So Leslie Mollencamp for the record. So at this point, I think we have covered agenda item number 5. Our next couple of areas on the presentation cover agenda item number 6. We can pause here or continue on with the presentation.
All right, members, agenda item number 6 talks about proposals moving forward. I do have some questions. I'm perfectly willing to wait until the end of the presentation, but if there are members that have questions up to this point, let me know now. Otherwise, I will move forward with the presentation and then kind of see what's remaining to be asked once we get there. Any other questions?
Speaker Frierson, I have a question regarding just this last slide we discussed.
Sure, Senator Brooks.
Thank you. My question is on this ever-changing guidance and how we can use these funds. Is it within the guidance or within the act itself that allocated the funds? What are the penalties for us misusing these funds or using them outside of the guidance? And who makes that determination? And is there a hard and fast line, or is there some subjectivity?
Leslie Mollencamp for the record. The Inspector General of the Treasury is the entity that is responsible for the monitoring of the fund use. And the penalty essentially on misuse of funds would be that if the Treasury finds that it has not been used according to the guidance and what has been deemed eligible uses, the Treasury will come back and collect that from the prime recipient. And so the prime recipient, in this case, for the $836 million would be the state. So if the state allocates to, as we allocated the 148 million to our local government entities, if they misuse the funds, the state will be on the hook for paying that back. Now, we have put in agreements with the local governments that should anything like that be deemed or indicated, we would actually collect from them to then return those funds to the Treasury.
Thank you. So the rules change 9 times in 120 days, and the penalty is that we have to take the money back that we've already spent and give it to the federal government.
Leslie Mollencamp, for the record, yes, that is correct. That if we were to use it inappropriately according to what the guidance was given, that it would be collected in the Treasury as since it wasn't used according to eligibility, the guidance that was given.
Thank you.
Thank you, Senator Brooks, for bringing that up and recognizing that the rules have changed so many times. Could you tell me if the rules thus far have changed in a meaningfully retroactive way? Like, we got it, it was vague, we used it a certain way, they changed the rules to narrow it to where now we're out of compliance. Has that happened in the past 120 days, and is there a concern about that moving forward?
Leslie Mollencamp, for the record. Yes, actually, there. Well, I'm pleased to say that the state of Nevada appears to not have been in that position. Much of it was due to the fact that we released a certain amount of funds a little bit later on to the local governments. But I can tell you that other states, other of the 50 states, pretty much shot out the gate and started allocating funds right away to their local governments, and then found out later that there was a major requirement, a major adjustment in that guidance that impacted the way that they had done it, and they had to go back and figure out what that meant. I can say, and I probably will turn it over to Director Brown as well if she has any other examples. Certainly, this is something we're concerned about on a regular basis. We do understand that we have to abide by these rules, and that one direction may be going at a certain time, and then if it gets updated and we're going in a different direction, we would have to figure out what to do with that.
Thank you. Before we move on with Ms. Brown, this agreement with local government, was that agreement that if there was a requirement to pay it back, that they pay it back? Was that required within the CARES Act or by the federal government, or was that something that we implemented? I'm glad that we did it. I'm just curious as to whether that was required or if that was something we did out of an abundance of caution.
Leslie Mollencamp, for the record. That was not a requirement by the Treasury to require collection of that. However, that was a pretty standard approach we saw with the rest of the states in that we did have to put some mechanisms in place because we were not really directly involved in how those funds were being used on a day-to-day basis. So that mechanism definitely was a cautionary mechanism that was put in place to ensure, that if should the state be on the hook for a misuse that was in the local government spectrum, that we would have a mechanism to collect it from that local government.
Thank you very much. And also to Senator Brooklyn, I am aware in speaking with leaders of other states that other states that have maybe been a little less disciplined in their use of academia, especially also had reserves ready in case they had to do that. Because I saw some and I asked them, "Are you sure this is okay?" And several had indicated they had been set aside in the event they had to get back, and they was not obviously in that place to be able to list that. I think somebody went hold to get a question.
Thank you, Mr. Chair. And I have just a couple quick clarifying questions. So one is on page 24. I noticed that we had 4.4 million for election security grants. And I was just wondering, did that cover the primary? Is that being utilized for the general election? Is that just at the Secretary of State level? Is it just at the county level? You just help me understand what that 4.4 million. And I do remember seeing in another document that we have 3 million that we allocated from that came along with it before for the mail ballot purposes. If you could just sort of walk me through that from page 24, primary general election and the use of those funds. I appreciate it.
The election security grants of $4.4 million that you're seeing there was for the primary election in June, and I believe the bulk of that money has been spent. The $3 million that you're referencing through the 32nd session, I believe, is for the general election that's coming up.
Thank you. And is that for the state and also the counties, or just for the state, and then the counties can apply for funds elsewhere to help with running the elections?
Susan, for the record, I would have to get back with you on that one, exactly how that money was allocated.
Okay, thank you. And then my other question is on page 32, just to make sure that I understood correctly, we're not to use this for the 2021 budget. However, if there's something that is, presumed to be longer term expense related to COVID, it could be used. So the first example that came to mind is that I know we can use CARES Act funding to help with education with the digital divide, for example, providing the education resources to students who are participating remotely. So would that be an example of where we could use that funds? There's two major focuses there. We have the devices, and then we have the infrastructure. And the infrastructure to get the Wi-Fi connectivity would be something that I would imagine would be a little bit longer term than between now and December 30th. Is that an example of where those funds could be allocated and in a way that would be, ongoing beyond just December 30th, not indefinitely, but a little bit longer term investment still related to COVID as a result of online learning?
Thank you for the question. Oh.
Go ahead. Go ahead, Leslie.
Thank you for the question, Leslie Mullenkamp, for the record. This is actually then, that is a really great question. It actually is a bit more of the other way around. This one can only be used for purposes that are from March 1st through December 30th. And infrastructure projects generally take quite some time. So we have found that when it comes to any type of broadband, anything that's going to require a more time, we have not been able to use a fund, even though that is an essential piece of what is needed and certainly would be directly related to helping in the way that we would intend it to. Because the funds are limited to December 30th, we're unable to do projects like that. They can't be turned around in that time frame. As far as it being the reference of it being budgeted, not budgeted, I think the challenge on that has been that we had a certain budget as of March of 2020, and we are not to use the fund to supplement any expenditure that would have been a normal part of our budget. It can only be used for coronavirus related expenditures. So the caveat on that is obviously it could be a budgeted item such as payroll, but if you had budgeted for certain services for that person, and now that it's been shifted to respond to COVID mitigation, that shift is why it is now allowed. So two very different rules, but the main thing, and I think the main point and really great question about education is that on those larger projects, especially when it comes to connectivity, those are generally larger projects, and we just simply can't do them by December 30th. That has been the biggest challenge.
That's discouraging to hear, but thank you for the answer. And my last question would be on, let's see, page 29 of the presentation. And I hope these are aligning. I'm just going off of the download of the slides on the legislative website, but it's the one that's titled Appropriations Nevada Total 1.25 billion. It says that the minimum payment of 1.25 billion is what Nevada received. Could you help us understand a little better? Did every state only receive the minimum payment? How does that compare to other states of similar size? And is there a reason why we received the minimum versus additional funds? Thanks.
Yes. Leslie Mollenkamp for the record. Again, really great question. The Treasury formula was based on population. And so they did have a minimum threshold for those states that have a smaller population. And it just so happens their formula, Nevada was a state that has a smaller population. So we actually received the minimum, the baseline, the 1.25 million or $1 billion, as because we did, our population is actually lower. So if they had not provided that baseline and it was just strictly on the formula, we would have received less than that. So in this case, we were happy to get the 1.25 billion. I think the other, as far as your question about other states, yes, that is correct. States like Montana, North Dakota, some of the other states that have smaller populations, they received the exact same 1.25 billion because they also had smaller populations and they ended up receiving the baseline amount.
Thank you so much. Thank you, Mr. Chair, for your indulgence.
Mr. Chair, Senator Goycochea.
Thank you. I'll go to Senator. I had a couple of people in the queue. Senator Kiefer.
Thank you, Mr. Chairman. I appreciate it. I wanted to just dive a little bit more deeply into what is considered expended by the end of the year. Is that in the guidance that we've received? Is that specific to appropriated, authorized, obligated? How is that defined? And as we think about potential future programs, whether it's for rental assistance or something to that effect, how do we determine whether or not that's expended within the appropriate timeline?
Leslie Mollenkamp for the record. I can definitely answer the first part of your question. This was one area, as we just highlighted, that the guidance documents and the FAQs have been updated quite a few times. We were given direction during the first guidance document that incurred meant actually expended. So that would mean anything that where the funds actually moved and were expended. It was their update, and I do believe it was at the end of June. Yes, I believe it was the June 30th update. The Treasury updated their guidance and then provided a very long explanation of what we could now identify as incurred, which is actually that the goods or services have been delivered, but the expectation is that those would be paid or the funds to to pay for those would happen within 90 days. So this is, and this is a great case of where we were collecting data based on actual expenditures at first. And when the Treasury guidance hit at the end of June and was updated, we now had to relook at that whole thing because we now had to actually say, well, what goods and services were performed during that performance period. So again, I think with that shift, it was a good addition that they had made because it will now allow for goods and services to be delivered through December 30th, and with the ability to actually make those payments within a reasonable time of 90 days. And then I think that answers the first part of your question. As far as how we are going to ensure that our own state agencies are going to be able to do that, that is a question we have been asking up front on all proposals, on all, of all programs. How are you going to ensure that you are not going to spend any of these dollars past that time? It has been a very big challenge when it comes to software service agreements, things that carry over past into a full year. Those are some examples of where it's been a challenge. Each agency or program that is looking to use the funds has to explain how they're going to continue the cost after December 30th without using the coronavirus relief funds. And I'm not sure if Director Brown has any more to add on that.
I do not.
If I could follow up, Mr. Chair. Just specifically like a rental assistance program that we've been talking about or that we have in place, how do we determine when a good or service is provided then? Is that an executed agreement between a landlord and the housing authority, and then we would have 90 days after that to pay? Is that, it's hard to, there are different ways you could probably calculate that. So I'm trying to figure out if we would have perhaps until the end of the year to execute agreements and then 90 days after that to pay, or I'm just trying to make sure that we have the sort of time and capacity to expend these dollars in the ways that are deemed most appropriate.
Leslie Mollenkamp, for the record. You bring up a really great point. Each program is unique in its uses. And I think with your example on the rental assistance program, the requirement is those funds would have to be out. There would be no going past December 30th. The last transfer of funds to a renter would have to occur on or before December 30th. Now, the actual services, because there's administrative costs involved in a program like that, those would have to be, those services would have to be delivered on or before that date as well. But if we had a bill, from, for example, for a website or, any kind of administration, those bills could be paid up to 90 days after that. But that good or service has to be delivered before that December 30th due date. So in the case of a rental assistance, that is when we would be able to send no more funds out to a landlord or a business or any other recipient.
I appreciate that. Thank you, Mr. Speaker.
Thank you. And this is, of course, all assuming that the rules don't change again. I'll go on to Assemblyman Roberts.
Thank you, Mr. Chair. So back to slide 29, and we had some discussion on it earlier about the rules and if we're in violation of the rules and a variety of stuff. I'm just curious as to the direct payments to Clark County and the city. Were those rules provided by the government, the federal government, on how much that they were allocated out of our 1.25 billion? And then my question would be, did we apply those same rules in determining the amount or how the rest of the municipalities got their funds?
Leslie Mollencamp for the record. Yes, thank you for your question. The rules on how there is a population formula that was provided by the Treasury, and it very clearly determined how they allocated those amounts, those direct payment amounts, to a city or a county with a population over 500,000, and they laid out the method to do that, and that was provided on the Treasury website initially as part of the announcement of the availability of funds and the ability to get those payments directly. For the remaining local governments, the smaller local governments, we applied the exact same formula to ensure that it was equitable.
And just a quick follow-up on Senator Brooks's comments earlier and some of the chairman's comments. So the state allocation that is left over is we're holding on to some of that in case there's rule violations, or that in case we have to backstop and pay back some. Or is that allocation of funds for that purpose, or we're holding some of that for that purpose? Just to clarify.
Leslie Mollencamp for the record. I believe Director Brown's going to be going over the allocation piece here shortly. Actually, I think it's coming up next, and
Okay,
she'll be able to talk about. Oh yeah, no problem.
I'll wait. Thank you.
All right, we'll go to Senator Goycochea.
Thank you, Mr. Chair, and I also might be ahead of the game here. I was just, as I look at the data I've got in front of me, it appears, even though you've got allocations to all the local government and the cities, there's only been approximately 3 that have been paid, actually received funds so far.
Leslie Mollencamp for the record. I'm not aware that, I just may need a rephrase of the question.
Again, there,
yeah, I think if you could just
in place from local government as far as what they, what their allocation would be. But again, I don't know how many have actually drawn down money.
Leslie Mollencamp for the record.
Have they written the checks to the local government? Because I'm hearing from the rurals that they haven't yet, not all of them.
Leslie Mollencamp for the record. Yes, and I think you're probably referring to the handout or the sheet that provides information about the local government planned uses. We have allocated, the allocation to the local governments was conducted in two increments, 50% increment first up front, and then a second one upon request and expenditure, validation of expenditure of the first allocation. And so what we have listed there, you can see there is the date that those local governments received their first half of the allocation. And you can see that all of them, with the exception of 3, have received their payments, their first allocation payments. The second column over there on that worksheet provides the actual second half of the allocation, and you're going to see that there are only a couple of them that have actually received their second allocation, and it's just due to timing. We expect that list will grow substantially in the next coming weeks.
Thank you. And again, I apologize if I'm ahead of where I should be.
Thank you. I'll go to Assemblywoman Moreno, and then I believe we will get into kind of information about what's left and what the plans are, that kind of thing.
Thank you, Mr. Speaker. And I think my question will kind of lead into what's left. So at the onset of this meeting, we heard from public comments from some of our local municipalities where they feel there was their understanding of the Treasury's rules were different than what the state's understanding was. So the allocations that were made, a number of the Southern Nevada cities and local municipalities did not receive funding that they felt that they were due. And we've heard that the rules have changed at least 9 times as we've gone along this process. But my question would be that as we're looking forward in the context of the plans of those next steps, and how could we address those differences moving forward with the monies that are left over? Because we know that those local municipalities did have some of the higher impacts from the coronavirus in their communities. So as we look forward with those monies that are left, how can we better address those local municipalities with the issues of funding that they have dealing with their constituents and small business owners in their communities with that funding?
Leslie Mollenkamp for the record. I do believe that one of the ways that we could look at least the allocation for the local governments is that what has gone out so far has been in line with the population based allocation that the Treasury set forth. And so each one of those allocations, whether it was from the Treasury down to the county and the city, or what was remaining from the state that was allocated out to those local governments, it was based on the exact same population-based formula. So at this point, we can say that those funds were essentially divvied out based on population. So I do believe that everything else is being reviewed as according to what is needed. And so I do believe that certainly some of those items are addressed in the programs and what's being approved in terms of what's needed, because I know that most of those are looking at direct needs and how do we address those. So hopefully that answers that question.
Mr. Speaker, can I follow up? So in saying that, so of the local municipalities that have had direct impact and costs and expenses that occurred since the onset of the coronavirus and did not receive direct funding from the state, if they are able to show that they have had these expenses that would qualify and they fit within those populations that are less than the 500,000, and we're getting towards the end where we need to spend this money before the end of the year, and they have actually spent it providing services for their constituents and providing housing assistance and rental assistance and what have you, and food assistance for food insecurities in these communities. Could that be a future work program to allocate these remaining resources to help those local municipalities that did not get funding in the beginning? And I hope that made sense.
Leslie Mollenkamp for the record. I think in this case, reviewing the rest of the presentation, because I think that will give you a good idea of where the allocations are going, and it may address some of that very directly, but we would be happy to answer that question. I think when you see really where the remaining allocations go, it might help to address that. If that's okay, to maybe see if we can revisit that question at the end of the presentation, that might help.
Okay, thank you.
Thank you.
I believe Assemblywoman Benitez Thompson, I think you have a question as well.
Yes, thank you so much, Speaker, and thanks for the question. I just wanted to circle back on a conversation we were having earlier, because something was ringing a bell about a specific action that we did during our first special session and allocations of funding and schools and the ability to have broadband connectivity and internet connectivity and devices and such like that, because we did pass we did allocate $50 million to Department of Education to allocate out to the school districts specifically for those purposes. And so I didn't want the record to be left that we couldn't do that, because in fact, we had in section 117 of AB3, and that maybe that distinction in that conversation, the takeaway for the public is, that we can't go out and do large infrastructure programs, but the state certainly is acknowledging, and we acknowledged in legislators who supported that bill, that need for internet connectivity, and in those allocations of funds really did want to encourage the school districts to look at access and equity and devices. And I know each district has approached that differently and distinctly, but just wanted to make sure that we were reflective of the work that we had done.
Leslie Mollenkamp for the record. Yes, I 100% agree with that. I think all of the state agencies and programs that have been looking to use these dollars have been extraordinarily innovative and resourceful in understanding that there are limits, and especially with education. They look to find the solutions where they would be able to get the devices and, hotspots and things that they could accomplish in such a short time. And they've done a wonderful job with that. I think, in acknowledging that, definitely want to differentiate if we needed to increase broadband connectivity in a rural area, though, that would be a major infrastructure project that would carry on far longer. So absolutely, I would agree. There's been a lot of innovative solutions to try to improve that connectivity despite the restrictions on the fund.
Are you good, Assemblywoman? All right. I don't think I see any other questions. If we can move on to the next part of the presentation, it'd be great.
Okay, thank you. Leslie Mollenkamp for the record again. At this point, we are going to move into another section of the presentation. I'm going to go ahead and turn the presentation over to Director Susan Brown, and she's going to cover a little bit more on where we're at with the Coronavirus Relief Fund expenditures and obligations and allocations.
So now that we've provided that high-level overview of the coronavirus relief funds, we'll take a look at where we're at with the expenditures, the obligations, and the remaining funds. And so there, Leslie, could you put the slides back up, please? So on this next slide, you'll see that there's been approximately $522 million that's been approved or finalized. And this is the majority of the dollars that have been approved since the May IFC and where we are at today with the allocations. So at IFC in May, there was $8.5 million that was approved for food security programs through the Department of Agriculture. $30 million was approved for statewide residential rental program. And then we had $848,000 that was approved for pandemic electronic benefit transfers through the SNAP program. $50 million that was allocated in the 31st special session that was just mentioned, $50 million. We've had $67.6 million that has been approved for for PPE and testing through the Division of Emergency Management, and $20 million for a rental assistance program. $3.1 million for a WIC home delivery program. $85 million to the Department of Health and Human Services for statewide epidemiology, laboratory, and contact tracing programs. And then through the 32nd special session, there was $3 million allocated for elections for public health and social distancing efforts related to the election, and $2.5 million to Washoe County and Southern Nevada Health Districts through Senate Bill 4. And then, as I had mentioned earlier, the $6.2 million that was provided to the Division of Emergency Management for match funds for the FEMA grants. And $96.9 million has been approved through work programs for reimbursement to state agencies for costs that have been incurred related to responding and mitigating to the pandemic. On the right, you'll see what is currently pending, and this is $312 million. $35 million has been set aside for PPE and testing for school districts. The September 3rd IFC approved about $6.2 million to start the testing program. And there is a work program that is in the works for PPE for school districts. We are working with the Department of Education and the Division of Emergency Management on that work program now. We are uncertain about any possible surge in the fall, so we've set aside about $75 million to prepare for that. We know we have much more to do in providing business assistance for economic recovery, workforce development support, and tourism, so there's $50 million obligated for these efforts. And work programs are pending for some of these funds now. State agencies are still trying to respond to the need to operate while also staying safe during the pandemic. We anticipate that costs may be higher for eligible CRF expenses in the coming months as agencies try to put up protective barriers, improve telework, and provide PPE supplies to employees and civilians. So here we've allocated $120 million in expected transfers to agencies to help with these and other eligible costs. A more recent development for the use of coronavirus relief funds is that it can be used to help with unemployment benefits to a greater extent than originally provided. I would note that this $12 million has been set aside to assist with costs at the Department of Employment Training and Rehabilitation. And that could be for things such as salaries of employees that work at other departments that are coming in and helping out to address the backlog for DETR. And then through Senate Bill 1, there was a program for alternate dispute resolution evictions program that was created through Senate Bill 1. $3 million has been allocated for that purpose, and we expect to see a work program come through fairly quickly on that. And finally, we have, for additional rental assistance, set aside an additional $10 million. And this will go to the counties where it is needed the most. So final decisions have not been made yet on where this $10 million will go. So you can see we have about $1.6 million that has not currently been allocated. However, this could be impacted by congressional changes, so target amounts are not set in stone. And because again, the guidance continues to change regularly, the final allocations may be impacted by these changes as well. So this final slide represents the FEMA funds that have come in through work programs to the state's accounts using CRF to match the federal dollars. If these coronavirus relief funds were not available, the state would have had to come up with other funding sources to match these funds. And you can see we've used $22.3 million in coronavirus relief funds to leverage $72.2 million in FEMA pandemic funds. That concludes our presentation, and we can answer any additional questions.
Thank you, Director Brown. I'll go to Senator Kiefer.
Thank you, Mr. Chairman. I appreciate it. So can we start talking a little bit about the reimbursement to state agencies? There was about $97 million, I think, on your slides for that have been already approved. Does that include both fiscal year 20 and then what was also authorized for fiscal year 21 what was presented during the special session? So is that everything that we've seen so far?
The $96.9 million that you see on the slide is specific to fiscal year 21. Fiscal year 21, there's $120 million set aside, and some of that would be what was allocated through the special session.
Okay, so I'm sorry. Can you say that again? I got confused. The $96 million was specific for 21, and then we're estimating an additional 120?
The $96.9 million was specific to fiscal year 20. Those are all the work programs that were processed for fiscal year 20, either through IFC or they didn't meet their thresholds and were approved by the governor's finance office. The $120 million for fiscal year 20 would include the amounts for fiscal 21 that would have been in AB3. For example, for the Division of Welfare, I believe there was about $15 million there. So that would be a part of that $120 million that you're seeing as allocations pending.
Yeah, so I remember Mr. Fisher presented with sort of great authority the guidance that authorized the use of these funds for the welfare field service officers that he was using. Do we have additional guidance for all of these other areas? I mean, this is about almost $220 million that we're using to backfill positions that we had budgeted for already. Is there any indication that this is going to be audited by the federal government? Is there a risk that we're spending this inappropriately, or do we have clear guidance for each of these expenditures like we had for welfare field services during the special session?
Susan Brown for the record. So yes, I believe that the guidance is clear and that we have, with all of the funds that we have obligated at this point, that is well within the guidance. And we do monitor that guidance every time it changes, and we refer to that. And there's a lot of research that has been done to make sure that what we are obligating these funds for are eligible expenses.
Is there on the item that was also listed on the sheet regarding the 25% of the National Guard expenditures? There was an article today indicating that our application for 100% federal reimbursement was denied. Is there a way to appeal that?
Susan Brown for the record. I don't have an answer to that question, but I can get an answer for you.
Okay, I mean, it seemed like, California received 100%, so did Connecticut and Florida. It seemed like there was no necessary rhyme or reason as to why Nevada was denied that. If you could follow up on why that denial was made, and if there's a process to appeal it, I would be appreciative. Thank you.
Susan Brown for the record. Michelle White is on the phone and she can respond to that question if we can get her on the line.
If you're on the line, Ms. Michelle White, please just press *6 to unmute yourself.
Thank you. For the record, this is Michelle White. Through you to Senator Keycup, thank you for the question. We did receive a call on Wednesday evening indicating that the state of Nevada did not get approved for the full 100% federal funding for Title 32 for the National Guard. The governor had made several attempts over the last couple of months to get approval for that. That is a decision that lies on the president's desk. He reached out requesting calls with the president, but did not receive any response back to get one scheduled. Reached out to the vice president and to the White House task force as well, and sent multiple letters of communication, emails, and communication directly with White House staff. But ultimately, again, it's a decision with the president. And on Wednesday evening, we received a voicemail saying that we did not approve that. We are still going to continue to try to receive 100% federal funding through this office and implore the White House and the administration to provide that to the state considering our current situation.
I appreciate that. And if there's any changes or updates, I'd sure love to hear about. Thank you.
Thank you. Other questions? Members? And I don't know, Assemblywoman Monroe Moreno, was your question ultimately addressed?
Thank you, Mr. Chair. I'm sorry that if you hear frustration in my voice. I hear it from the citizens in my district and the small business owners in my district, and we heard it from our local municipalities at the onset of this meeting, how they feel that our communities have been marginalized even more than they already are. So I would really like to be able to tell them that as we're looking forward to this money that is left over, that the expenses that the local municipalities have faced in dealing with the higher numbers of COVID-19 cases in our communities, that there will be, as the state is looking towards the future with those fundings, helping those local municipalities deal with those added expenses that they have had. We're seeing that people are not going back to work in the numbers that we had hoped that they would be able to go back to work. We're seeing people lose their homes, have difficulty feeding their children, and we're still doing digital classrooms. You know, right now I'm in this meeting, but I'm also the digital classroom teacher for my grandchildren. So I'm frustrated because our numbers are so high here. So I would really like that there would be a plan as we're moving forward to make sure that if those monies that are still left for COVID that we have to use by the end of this year would be able to be utilized in those communities that did not receive the direct funding either from the federal treasury or from the state to deal with the expenses, the added expenses that they have had to deal with.
I don't think that was a question, was it, or more kind of a statement expression, Assemblywoman?
It was more of an expression. I apologize.
Yeah. And I'd like to add, I think that it's difficult to answer these kind of questions when we're only dealing with the state part of it. And I heard of local officials as well. I think that in subsequent meetings where we'll have an opportunity to have local government, I think we'll certainly be able to revisit these. But at the very least, I believe moving forward, a lot of this is going to require collaboration and planning up front. And I have said frequently that, you know, COVID didn't send us a memo saying it was coming and we had to adapt. And it's going to require all of our local governments and the state to collaborate and communicate and coordinate. And I think we'll obviously hear more from local government moving forward as well. While I'm at it, I think, you know, Health and Human Services, K-12 and higher ed, emergency management, public safety, and local government economic development are areas that I think we will likely want to address moving forward. And so just so you all know, obviously, this is going to be the only time that we are able to have these conversations. And I'm certain that this presentation will give rise to, you know, more questions and more requests as we move forward, as well as a forum to make recommendations. Let me make sure we have.
Chair, if I may.
Senator Goitia?
Yes, thank you. And I guess maybe I represent rural Clark, although I don't represent like Boulder and Mesquite and North Las Vegas. But again, they were excluded from the original distribution. And then I can understand the frustration when you look at some of the smaller rural cities that are, you know, got significant monies. And so I guess I'm wondering, was in fact Clark County supposed to distribute to those cities in their jurisdiction, or it seems to have blocked Clark County out? Did I kill the computer?
No, I don't, BPS, do we still have Ms. White on the line?
Yes, Speaker Frierson, this is Wakanda Carter from Broadcast. If you could just hit your mic button. Give us one moment, Speaker Frierson.
Are we having technical difficulties?
I can hear you.
Speaker Frierson, this is Melissa from Broadcast. I believe we were waiting for the presenter caller to unmute herself.
Oh, yeah, it's not, what's that, it's *6 or *9, what is it?
It's *6 to unmute. Well, we're going to go ahead and try to get her back on the line.
Okay, and I believe there's another question. I think Senator Kiki has a follow-up.
Thank you, Mr. Speaker. And as we're waiting, it's probably from Ms. Brown. I know that we deposited all of the $836 million into a single state budget account. What is the current balance in that account? So ultimately, how much do we still have to push out the door?
I believe she's on mute.
Ms. Brown, I think you're muted. I can't hear you. Ms. Brown, if you can hear us, we can't hear you. You're muted. I don't have the little red microphone, but yeah, I don't know.
Speaker Frierson, this is Melissa with Broadcast. We are going to take a short little break just to see if we can get that presenter Zoom up and rolling. Please stand by. We apologize.
All right, so a quick break.
Mic check 1, 2, 3, 4, 5, 6. Check 1, 2, 3, 4, 5, 6. Mr. Chair, I believe we got our issue worked out. So we are ready to continue.
Great, thank you. Were we going, do we still have Ms. White on the line? Or is that where we were? Oh, I think we're Ms. Brown as well. Ms. Brown, are you able to unmute? Well, we still can't hear you, Director Brown.
Chair Speaker, we apologize. If you could just give us a couple more seconds here, we'll see if we can get this worked out. One moment, please, sir.
Sure, committee, I'm not, I mean, we're close to, I mean, we're at the end of the presentation and we still, obviously after that, have public comment. Why don't we just take a 5-minute break? We've been at it and, you know, folks may need a quick break anyway. So if you all could come back, it's 12 o'clock straight up right now. If you can come back in 5 minutes, maybe we'll be able to finish this up.
Thank you so much for your patience, Chair and Committee. You are now ready to roll.
All right. I think where we were, I think Ms. Brown, I think was addressing a concern raised by, was it Senator Goycochea and or Assemblywoman Monroe Moreno?
Yeah, it was kind of a combined question, Mr. Speaker, Mr. Chair, but yeah, just curious if Clark County was supposed to actually pick up the pieces for those jurisdictions, Boulder, Mesquite, and those cities in Clark County.
Leslie Mollencamp for the record. And I believe this is where we were at before. I was going to pretty much outline the structure of how the Treasury allocated the funds, and it was based on population. And just to give you an example of how it worked, any entity that qualified to receive the direct funding used the population within that entity as the factor or the amount that was given. So when both Clark County and Las Vegas, the city of Las Vegas, qualified, the formula called to fund the city first, basically to take that population amount and extract it out and then provide the funds based on the population of the city first. Then whatever was left over in the population base for the county would then be funded based on the remaining population. So when both entities were funded, the city of Las Vegas was funded very directly for the direct population that was within it. But the county, Clark County, was funded based on all of the entities other than the city of Las Vegas that were within that. And that was what the amount that was allocated. So essentially, the cities, Boulder City, Henderson, North Las Vegas, their population was put into that formula for Clark County.
A follow-up, if I may, Mr. Chair. Then as we did the distribution, and I say we on the state side, but clearly we did it for a county, let's say Elko County, and then we reached out to the city of Elko, Wells, Carlin, Wendover, and they received an allocation as well. So I was just curious how that worked.
Leslie Mollencamp for the record, that we followed the exact same formula that the Treasury used to do that. And so when we calculated our formula, it was based on the exact same formula. And so in the example of Elko County, we pulled out the population bases for Carlin, Elko City, Wells City, West Wendover City. We applied the population formula on that, and then whatever was left over was what was allocated to Elko County. And again, this was the exact same formula that the Treasury used for their direct allocation.
But then why didn't that happen in Clark County? I guess I'm missing that. I realize you're saying Las Vegas proper took the first cut. Clark County got the rest. But then why, in fact, didn't we consider, I guess because it was the feds that did it, so that we didn't have that opportunity. Thank you. I'll rest there.
Woman Moreno.
Thank you, Mr. Chair. I just kind of wanted to piggyback on what Senator Goycochea was saying. And I want to say that, you know, in Clark County, our county commissioners have been wonderful, and their partnership with our cities have been great. And the cities are very appreciative and thankful and grateful for the partnership that they have with the county. And the county has been able to give them some funding, just not the amount of funding that those local municipalities feel by their population that they were due. And in saying, I appreciate the comments from the state about the allocation for population and following the rules of how that allocation was decided. However, we're dealing with a virus that had no rules to follow, and it didn't care about the population. And unfortunately, we've seen the higher numbers of COVID cases in Southern Nevada. So hopefully moving forward, although there may be rules of how the the funding came down from the federal government. There may be some disagreement between local municipalities in the state of how that is laid out. We do know that the cases of COVID-19 have been much greater in Southern Nevada. So perhaps as we look at future funding going forward and depleting what's left of our CARES dollars, that we go by where the cases are greatest, not necessarily looking at the population numbers, but the actual cases of COVID.
Thank you, Assemblywoman. And again, I think that when we have an opportunity to hear from local government as well, we're working through this as we go. And when we have to make adjustments, I think we certainly need to be open to making those adjustments.
Mr. Chair, may I jump in just briefly? So I just appreciate that conversation. Can you see me all right? So I appreciate this discussion, and I want to just echo the sentiments of Assemblyman Monroe-Marino about just taking a look at how the formula for how it's allocated. And I understand maybe the initial reasoning behind population-based, but I think factoring in a need-based assessment is also appropriate. And I would add to, in addition to the number of cases, also, since there is a good portion of this that has to do with economic relief. And I know that, just hearing the comments from Assemblyman Monroe-Marino, just the hurting, families, people who are out of work, losing their homes, et cetera, also be factored into that, because it could be that they don't have a case of COVID, but that they are in a region where they're economically impacted disproportionately as well. So I just think both of those factors are worthy of being considered. And additionally, I would just like to echo the sentiment that I think having the next meeting incorporate county and city representatives so we can hear from them is just an excellent game plan for an agenda. And I know that we are somewhat short on time, as we look at really just a couple months left for these funds to be allocated. And I know that we're all busy, but this is a priority. Just wanted to express a willingness to make this a priority, to meet and do that as quickly as possible as we address these urgent needs. Thank you.
Thank you. And again, I think it's worthwhile to reiterate, we are not in a position to allocate funds other than through work programs for IFC, but we certainly are in a position to give the state an opportunity to lay out what's been done and going to be done, and hear from folks that have suggestions. But along those lines, I want to go back to Director Brown. I think when we kind of got frozen, Senator Kiefer had a question about the balance. I don't want to oversimplify it. Senator Kiefer.
Yeah, no, it was pretty much that simple. What's the current balance in the account that we deposited the $836 million into?
The current balance is about $614 million. So $104 million went out in fiscal year 20, and so far in fiscal year 21, we've had $117 million go out. The $50 million for education has been allocated, but we have not received the request to reimburse for those costs yet. And the Division of Emergency Management has encumbered $60 million in expenses. So we have not received requests for reimbursement on those funds either, but those are also pending, as are all these others. And we are reaching out to the entities who have received these funds to get a better update on where they are with their spending.
Because that's okay. So 614 million left, and we're feeling confident we're going to get that all out before the end of the calendar year, right?
Susan Brown, for the record. We are pretty confident that we will have these funds expended by December 30th. Yes.
Thank you, Mr. Chairman. Thank you, Ms. Brown.
Sure, Director. If you along the same lines. Obviously, the rules are changing as we go. We're doing, fairly well and hope to not have a resurgence. But what is the plan if for whatever reason it appears that there are remaining funds leading into December 30th? What's the plan for the remaining funds?
So at this time, barring any changes at the federal level, the plan is to put any funds that are remaining as of December 30th into the unemployment trust account. As you know, we have expended, I believe, about $1.8 billion there, and we can use these funds to help loaning of funds we need to pay out those benefits.
Thank you, and thank you, Director Brown, and your office's work with us collaboratively during the special sessions to kind of flush that out and make good use of it. That we want to be prepared just in case.
Mr. Speaker. Yeah, I wanted to follow up on that. So the current plan is to take any unallocated or unused CARES Act money and to backfill the UI trust fund. Did I just hear that right?
Susan Brown, for the record, that's correct.
Are there, okay, I mean, that's not something we usually support with other sources of funds. There are dedicated taxes that go to that trust fund. Are there any other opportunities to use those funds in a way that would comply with the parameters of the act itself and the guidance we've received so far, if they're not expended for a specific purpose?
So with the guidance changing, we've had some recent guidance changes that we need to work through that may provide some other opportunities to expend these funds on salaries that were not previously allowed, might be one option. So we are really looking into how we can spend these funds to make sure that we don't have anything left over at the end.
Is state unemployment a specifically called out allowable expense under the guidance so far?
Susan Brown, for the record, yes, it is.
Okay. I'd like to circle back on this one, Mr. Chairman, at a future meeting. The UI program is something we're going to fund anyway, one way or another. And I'm just not sure if it's the highest and best use of these dollars. Thank you.
Thank you. And I don't want to mislead everybody by suggesting that this is the plan. I think this is the worst case scenario contingency if things change or adjust to where we get to December 30th and it has not, there's anything left that has not been utilized. But I think the best laid plan is to use it for the set forth purposes and make sure that we don't get there. And correct me if I'm wrong, Director Brown, I think, I don't want to speak for you, but what I heard was that we don't plan on getting to that point. Because many of us keep asking, if we do, for whatever reason, end up at that point, this is what would happen. But the plan is to not have money left over. The plan is to use it for the set forth purposes. Am I accurate in that?
Susan Brown, for the record, yes, you captured that very well. Thank you.
If I just a couple more questions, backing up a little bit, as we move forward and hear from other stakeholders and local government and whatnot about ideas and recommendations, do you have an idea, Director, when additional requests to use coronavirus relief funds to be brought to IFC?
Susan Brown, for the record, there is a work program that I received yesterday or the day before for economic recovery through GoEd that is pending. And we are working with the Department of Education and Division of Emergency Management, like I mentioned earlier, on PPE for school districts. So that work program should be coming forward fairly quickly. And then with the information on the Nevada National Guard on the 25% FEMA match, that one should be coming forward as well fairly quickly.
And so right now, is there not a balance of unallocated federal dollars available right now. I mean, if folks are going to be coming to make requests, for example, is it a request that's only if for whatever reason some of these other programs don't work out, or is there, an account or a balance available for additional requests?
So with guidance changes and requests changing, the priorities do change, and we would consider those requests as we receive them.
Thank you. All right, other questions? I'll check the chat. I don't see any.
Yes.
Oh, okay.
Assemblyman
Roberts.
Thank you, Mr. Chair. Just to digress back on my previous questions earlier on the guidance on disbursements to local governments. So the state kept its allocation of roughly 54% of the total dollars, and the remainder was allocated to local governments and municipalities. So was that in the Treasury guidelines, the percentage that the government or the state government holds?
This is Leslie Mollenkamp for the record. That actually was in the law itself. Okay. So it did provide a very specific call out on the amount intended to go to local governments being 45%.
Thank you.
All right. Any other questions? I think a lot of folks are wanting to wait for some of the other stakeholders and their opportunity to present and have some questions answered. Here we go. Oops. All right. Well, I think that concluded the presentation. Am I correct, Director Brown?
Mrs. Brown, for the record, that's correct. That concludes our presentation.
Okay. Well, thank you again, and I appreciate the work not only that we did leading up to this through this interim, but recognizing that it's valuable to have this conversation and let the public know where we are and what our plans are moving forward, and quite frankly, to convey a sense of readiness that we are preparing for different contingencies. So again, I mentioned it earlier. I will reach out to members about subsequent meetings. Obviously, we need to coordinate, but the things that I mentioned earlier are the things that I think are on the table, and that's the various departments. Let me find my notes here. Between K-12 and higher education, emergency management, public safety, local government, and economic development. I will reach out to members about thoughts that they have and ideas they have on structure moving forward to roll this out and create a productive way to ask these questions and get this out in the public, and then make recommendations if we have any that are not already taken care of in the plans that are set forth. So with that, and again, thank you, Director Brown and Ms. Mollenkamp and the Governor's Office for providing this information. I think it's very important for us to be able to have this conversation. I don't believe there are any other questions right now. So I am, unless Ms. Jones tells me that I've left something out, prepared to move on to item 7 and provide just a couple minutes for VPS to get ready for our public comment.
Chair Frierson, I think you are right on track, and the next item would be a second opportunity for public comment. Thank you.
All right, thank you very much. And for you all, even though we've had less time, I did look at 2009 and the ARA funding and the way that we did a similar exercise in reviewing what those federal dollars were being used for. And I think that we are right on track, although schedule-wise quite a bit off, but on track with the first meeting having been an overview and then subsequent meeting going into some details. So with that, if we can just take a couple of minutes, BPS, if you can let us know when we're ready for public comment, and we'll go ahead and provide that. Again, it'll be limited to 2 minutes per person, and we will see who's remaining that would like to be on the record.
Chair, I believe we are ready to proceed with public comment if the committee is ready.
So let's proceed with public comment.
Caller with the last 3 digits of 029, please slowly state and spell your name for the record. You will have 3 minutes. You may unmute yourself and begin.
No further comment from Lisa in Boulder City.
Thank you very much. Chair, we have no further callers at this time.
All right. Well, thank you again, and thank you all for your thoughtful conversation about this. Looking forward to hearing from you all about ideas moving forward and scheduling a subsequent meeting to get a better grasp on this and be able to our neighbors about what we're doing between now and the end of the year to make best use of the funds available. So with that, and there being no other comment, we are adjourned. Thank you guys so much.